Welcome to video 3 of chapter 9 in our significance test or hypothesis test chapter. Today, we're going to review a little bit here to begin with, and then we're going to talk about some decisions that could be made regarding our significance test that may result in some errors. So first off, tests of significance or hypothesis tests assess the strength of evidence against the null hypothesis. So where do we get this evidence from? We get it from our random, hopefully random sample that we are getting from our population of interest. We measure the evidence by this p-value. The p-value is that probability that is calculated under the assumption that the null hypothesis is true. So we're initially going with our null hypothesis, and whether it be a claim that is being made about our population, or just, what has typically in the past been known to be true. But we are putting that under the test. We're putting it under the spotlight, if you will. And we're taking a sample statistic, and we are calculating a p-value based on it, and it is going to be used as the evidence to determine whether or not that the null hypothesis still is true, or maybe it's not true anymore. The alternative hypothesis, the statement we seek evidence for, enters the test only to help us see what outcomes count against the null hypothesis. So that p-value is going to help us to decide whether the alternative hypothesis or the alternate hypothesis is maybe a better value or a better direction that we should go in compared to our null hypothesis. And if our result is significant at our alpha level, and we get to either decide, or the problems will tell us what the alpha level is, but that alpha level is kind of the line in the sand. Typically it's 5%, but it doesn't always have to be 5%. But it's that level that we will judge whether we should reject or fail to reject the null hypothesis. All right, so our first scenario we have here, and poor baby in the background's getting, whoa, there's blood coming everywhere. Whew, glad I'm not that baby. Consider a large hospital that needs 50,000 baby needles of diameter 2 millimeters. The shipment is in the right box, but the needles look too big. I mean, look at that baby. Look at the blood. It's got to be too big. The inspector is not going to measure every needle. He will randomly select a sample and measure the diameters. Surely there will be a little variability in the measurements. Based on the sample outcome, the shipment will either be accepted or rejected. So we're going to introduce this topic of type 1 and type 2 errors. But before we officially talk about what type 1 and type 2 errors are, here's initially our two decisions that we may potentially make in a significance test. If we have enough evidence against the null hypothesis, we will reject the null hypothesis. And we think that the shipment of needles does not meet the standards. Let's get them out of here. They're going to, again, we're going to do this to babies left and right all day long, and parents are not going to be happy. Babies are not going to be happy. Or maybe based on our sample evidence, we might decide just to fail to reject the null hypothesis. And we think the shipment of needles, they're okay. We thought they looked too big, but you know what? Based on our sample, we just don't have the strong evidence against that they're too big. So we will fail to reject the null hypothesis. So here are the two errors that we could potentially make. Now, I want you to keep in mind that we will more than likely never know the truth about the population. And we're just going to make our best statistical guess, essentially, with our p-value based on our sample value, if we should reject or fail to reject. And you know what? Sometimes we may reject the null hypothesis, and the truth in the end is that we really shouldn't have. We just ended up with a sample that it just happened to be, due to sampling error, maybe a lot of smaller values or maybe a lot of bigger values. And that caused our p-value to be smaller than what it normally would be if we had taken maybe a different sample. So our two types of incorrect decisions are going to be this. We can reject a good shipment of needles, And that's going to end up being a waste of time for the manufacturer, for the hospital. They still need needles, so they're going to have to make another order. They're going to have to wait who knows how long. A day, 2 days, maybe if it's Amazon Prime, it'll be there, in 2 hours. Who knows? Or we can keep a bad shipment of needles, and we could end up hurting a bunch of people, a bunch of babies, with these extra large needles. Now, I've broken down all of our decisions into a little two-way table here. Now, let me show you this. So here's what we're going to do. This is our decision based on our sample. We are either going to reject the null hypothesis if we have enough evidence, if we have sufficient evidence to reject the null hypothesis, or we will fail to reject the null hypothesis. We just don't have enough evidence against the null, so we fail to reject it. We're not saying we accept the null hypothesis, we just don't have enough evidence to throw it out the window. Okay? Now, this other thing up here is the truth about the population. And again, we aren't really ever going to know whether we're making the right decision or not. Okay? So just know, if the null hypothesis really was true, okay, let's say in the end, I tell you the truth about the population value. And so if we fail to reject the null hypothesis, and it really is true, then we made a correct decision. Okay? Let me go to the other case here. What if we rejected the null hypothesis? We believe we have enough sufficient evidence to reject it, and it really is true that the alternate was the correct decision to accept there. And again, we made a correct decision. So there will be cases where we reject the null hypothesis and it really was the right decision to make. And there's going to be times where we fail to reject the null hypothesis and it really was the correct decision to make. But in each of those cases, what if we reject the null hypothesis, but truth comes out later that we really shouldn't have rejected it? Then we have committed what's called a type 1 error. So again, a type 1 error is when we reject the null hypothesis, but we really shouldn't have, because it comes out later that the null hypothesis was really okay. It was okay to take that value. The other scenario is going to be that we maybe fail to reject the null hypothesis, and so we hold on to the null hypothesis, but truth be told, the alternate was really the right decision to make. So it was, it's kind of weird. We feel like we're being lied to here, that our sample value that we got our p-value on really kind of deceived us, if you will. And so if we fail to reject the null hypothesis, but we really should have rejected it, then we will have committed what's called a type 2 error. So you're going to have to remember which way these two things go. And I'll be honest with you, I think these two errors, just keeping them straight in your mind, I think is one of the toughest things to remember out of the whole chapter. I'm not saying it's a difficult thing, but once you get it squared away about which type of error is what happens in which scenario, then I think for the most part you'll be fine. But again, that's just me. This is what I think I would struggle with the most. So again, when we reject the null hypothesis, but really we shouldn't have rejected it, then that's our type 1 error. And so the way I think of this, here's how I kind of try to keep it organized in my mind. In a significance test, my goal is to try to reject the null hypothesis. I need to try to get enough evidence for me to reject the null hypothesis. And so if I just think in the back of my mind, my first goal of a hypothesis test, of a significance test, is to try to reject the null hypothesis. And if that's the first thing I try to think of, then I relate that to a type 1 error. Again, the one thing I want to try to do with a significance test, type 1 error. The one thing I want to do in a significance test is try to reject the null. Now, on the other hand, if you say, well, I don't really care if I reject the null hypothesis, then you've made a type 2 error. So if we fail to reject the null when in fact we really should have rejected it, type 2 error. Now, there are probabilities associated with making a type 1 and type 2 error. And the probability of making a type 1 error is really just our alpha value that we use. And again, you will be told what that particular value is from problem to problem. And so if we said, hey, let's test this null hypothesis at the alpha equals 0.05 level, well, then the probability that we make a type 1 error will be 0.05, will be 5%. Now, the probability of making a type 2 error is beta. And we'll talk more about beta in video 4. The good news is we won't actually have to calculate beta. That would be something that you would cover more in an advanced level statistics course. But in the next video, we will discuss a little bit more with the concept of this beta probability value for type 2 errors. So the only thing you know for right now, for sure, is that a type 1 error has a probability of alpha. And whatever alpha is set to be in the problem, that's the probability. Now, in terms of a court case, maybe you're still not quite sure exactly what a type 1, type 2 error really means here. So let's break it down into a court scenario. So we have a defendant, and a defendant has been charged of a crime. But in a court case, the jury never finds the defendant innocent. We're trying to determine if we should find him guilty or not guilty. And if the defendant is guilty, we have enough evidence. There was enough evidence presented in the case, or what we would say, we had enough evidence in our sample to determine that the null hypothesis should be thrown out and should be guilty. Now, sometimes we don't have enough evidence to reject the null hypothesis. And so the jury would never say that the defendant is innocent. They would just say that they're not guilty. Because there's still a chance that maybe the defendant really is guilty, but we don't know it. Maybe there just wasn't enough hard evidence against the defendant for the jury to come out and say, you know what, he is for sure guilty. I mean, there was blood, there was DNA, there's all this stuff, like for sure this dude is guilty. But sometimes in court cases, it's not, a slam dunk case. And so there's maybe very little evidence against the null hypothesis or against the defendant. And so if the jury comes out in the end and says, we're going to reject the defendant, we're going to reject his innocence, we are going to find him guilty. And again, this is what the jury and what really everybody doesn't know here, with the exception of the defendant and maybe his lawyers. But what if he really is guilty and they found him guilty? Well, good, they made a correct decision. What if there's not strong enough evidence against the defendant or the null hypothesis and they find him not guilty? And what if, in the truth of the matter, he really is innocent? He really didn't do the crime. Well, cool, correct decision. Good job, jury. But then again, we find our type 1 and type 2 error. What if they find the defendant guilty, but the truth is he's really innocent? And so this is kind of bad for the individual. We're sending an innocent man or woman to prison, potentially. And so that's not good for them, right? I mean, everybody else is safe, but this person never committed the crime. So they're being just wrongfully accused here. Now, the other scenario where they find the defendant not guilty, but he really was guilty, is our type 2 error. And so this person gets to go free. They get to go back into society and live their lives as they did beforehand. Well, we would kind of say this is bad for society. We've got a criminal that the jury said is not a criminal, but the defendant really knows that he did the crime, right? But he got away with it. So this is kind of bad for everybody else. So a type 1 error in terms of a court case is bad for just that person because they're really innocent, but the jury found them guilty. Versus in the other case, it's kind of bad for everybody else but the defendant. I mean, the defendant's the only one that's kind of good to go here. He's happy to have a type 2 error, that he's found not guilty, but he's really guilty. Now, this was a diagram that I found on the interwebs, on the internets, and this really hits both scenarios here. So these two curves represent sampling distributions, and they consider two various situations kind of at the same time, okay? So you have to look at this one at a time. So let's imagine that an innocent person really is arrested and they're taken to court. So we're just going to focus on this left sampling distribution over here. And there's going to be evidence that'll be presented against them. And the jury's going to have to decide. There's this alpha level, the standard of judgment. And if it falls one way, then they will say, well, we're going to say that they're not guilty. And so that would be the correct decision to make, right? If they came back with a not guilty verdict and the person really was innocent, good. That's good. But if they came back with a guilty verdict, so they're on this side. So this part that I have highlighted in red, this is still a part of this sampling distribution that's on the left here. And that would be a type 1 error, right? That we found guilty an innocent person. That was bad for the person themselves. So this is going to represent that little bit of probability, probably 5% if that's what the alpha level is. That would be the probability that we got it wrong, that the jury got it wrong. Now, on the other hand, we've got this sampling distribution that I'm going to highlight here. And this represents if the defendant really was guilty. And so, again, there's evidence that's presented against them. There's this alpha level that we're going to kind of draw in the sand here. Maybe it's 5%, maybe it's 1%, whatever the case may be. And so if the jury comes back with a guilty verdict and they really were guilty, cool, you made the right decision. But again, on the other hand, what if they came back with a not guilty verdict and the person really was guilty? Well, now we have this tail that's over here, and I don't want you to think these two tails are the same area. So don't think that this is the same probability as this, but this would represent our type 2 error, that we just had a not guilty verdict for a guilty person. This is bad for everybody but the defendant. All right, an example. A new medication approved by the FDA has been accused of having harsh side effects for its patients. It was known that the medication may affect a patient's kidneys. In order for kidneys to be considered failing, they must have lost 80% of their ability to function, thus resulting in dialysis. The pharmaceutical company who manufactures the drug claims that in their clinical studies, patients only experienced a kidney loss rate of 50% and therefore never required dialysis. A large number of patients have had to start dialysis treatment after being on the medication. Doesn't look good. Pharmaceutical company says, hey, our medicine's fine. Our patients don't need dialysis. On the other hand, people started taking the medication, and a lot of them had to start taking dialysis. Seems like someone's lying here. Who is it? Is it the pharmaceutical company that's lying? Or is it just, random chance, unfortunate sampling error, that we've got a lot of people in our sample that happen to go on dialysis treatment? So there's the court case. A neutral third-party company, aka the jury, decides to settle the issue and take an SRS of 500 patients currently on the drug to measure what percentage their kidneys are functioning at. So number one, state the hypotheses and define the parameter of interest. All right. So let's get our null and alternate hypotheses written here. So the null hypothesis, the alternate hypothesis, let's go a little bit thinner here. There we go. Okay, so this is a proportion problem. So we're testing out the population proportion, and our null is always going to be equal. And we are putting up to a debate here whether they've lost 80%. Because if they've lost 80%, they still have 20%. But if they've lost 80%, then they got to go on dialysis. The pharmaceutical company says, our patients only lose 50%. But a lot of patients, again, had to go on dialysis. So it's seeming more like they've lost at least 80%, right? But this is the initial claim, this 80%. This is what we have to put under debate here. So we're checking to see if the proportion is actually 80% versus that they have lost more than 80%, right? If they lose more than 80%, then they have to go on dialysis. So P, the population proportion, is the proportion of kidney loss. Proportion of kidney loss. All right. So again, null hypothesis, we're going to put it right at 80, because if it's more than 80, they got to go on dialysis. So there's our alternate. There's where we're showing, yeah, these patients really are having to go on dialysis. It's more than 80% loss. Number 2, describe type 1 and type 2 errors in this situation. All right, so let's try to remember what type 1, type 2 was. So type 1 is when we reject the null hypothesis, but we shouldn't have. But we shouldn't have. And a type 2 error, let's do this in a different color, is when we fail to reject the null hypothesis, but we should have rejected it. But I'll just say we should have. Now, I'm not looking for you to basically just give me the definition of a type 1 and type 2 error. I want to know, what does this mean in this particular situation, in context, okay? So a type 1 error would look like this. So first I'm going to talk about what did it mean to reject the null hypothesis. So we believe, if we reject the null hypothesis, we believe kidney loss is over 80%, right? If we reject the null hypothesis, we're going to go with the alternate. We think the alternate's the truth. So we believe kidney loss is over 80%. But really, it is not over 80%. Now, if you wanted to say that it's still really 80%, that it's still really the null hypothesis, you could. You could say that it's really at 80% or less. But what we want to say is that it's not over 80%. So I would just kind of state it as this. We believe kidney loss is over 80%. And so if we think that, if we think the kidney loss is over 80%, we think these patients are going to go on dialysis more, and we think this medicine that they're on is really hurting them more than anything. But really, it's not over 80%. So again, we think that the medicine is harming them, but really it's not. All right? So type 2 error. Let's talk about that. Type 2. So we believe, again, we fail to reject. So we believe kidney loss is at 80%, really, or less, right? We're not on dialysis. We believe it's at 80% or less, but really, it exceeds 80%. So what this means is we think the medication's okay, that it's not really making our patients go on dialysis. But really, it is bad for them. It is making them go on dialysis. All right, so now number 3. Which type of error, type 1 or type 2, is more serious, and why? All right, so again, let's run through our 2 scenarios here. We believe that the medicine's making them go on dialysis, okay? But really, it's not. So we're going to get rid of this medicine. If we think that this medicine's making them have to go on dialysis, it's going to get shut down. These patients aren't going to get this medicine anymore. But really, it was okay for them. Maybe it was helping them, you know. Type 2, we believe that their kidney loss is at 80% or less, but it really exceeds 80. So, man, what we're saying is that we think this medicine's okay, that it's not hurting the patients. But really, it is hurting the patients. We're continuing to basically poison them with medicine that is making them go on kidney dialysis. So I would argue that a type 2 error is the more serious one here. And will it always be a type 2 error that's the more serious error? And I'd say not necessarily. I think it just kind of depends on the context of the problem. So I would say a type 2 error is more serious because we are going to still allow patients to take this medication when really we should stop giving it to everyone. It's not good, right? Again, the one case, we're getting rid of a good, and some people might go, well, what if we get rid of this medication that was really okay for them? Well, now these people are, maybe they're now going to suffer in a different way. Well, that's true. So it kind of depends on how you want to present your argument. But I would argue that probably the type 2 error is the worst one, that we're going to continue giving them medication that's really not good for them. All right, and then what significance level do you think should be used in this situation, and why? So, again, let's jump back real quick here to our type 1, type 2 errors here. We said a type 2 error was the more serious error to make, right? And so in the end, we really want to be able to reject the null hypothesis. But we want to make sure that we have strong enough evidence for it in that case. So if we want to make it easier to reject the null hypothesis, right? Because we want to reject this medicine if type 2 error is really more serious. We want to make it easier to reject the null hypothesis. So that alpha level was all about rejecting the null hypothesis, right? And so I think we would want a higher alpha level to make rejecting the null hypothesis easier. So we might go with our standard 5% alpha level. So maybe alpha equals 0.05. Or we could go a little bit higher, like maybe 10%. I would say 1, 5, 10%. Those are the ones you're primarily going to see used in problems. And so, again, we'll just state a higher alpha will result in the null hypothesis, the H sub O, the H sub naught, will result in the null hypothesis being rejected more easily. All right. Now, I've got an example here for you. You can read through this. This is basically kind of describing the same situation that we just went through. So you can kind of pause the video, read through this if you like, and then you can look at what the answer is here. And now I would like you guys to try this problem out, which again is very similar, just a different context of the problem that we just went through. So good luck with this, and we will discuss this the next day in class.